Before I got into my Lyme doc, or Dr. Diane as I call her, I was feeling overwhelmed. I was frustrated and I was confused because my house had had flooding and I got mold. Then I got mold illness, and then it activated a previously dormant Lyme. And I was having really bizarre symptoms and just the brain fog, the fatigue, the rashes, and it was traveling. The symptoms were so weird. I didn't know what to think of them. When I went to the doctors, they didn't know what to do with me. They're not familiar with mold and Lyme. And there was one that was, and he didn't have time. It was a 15-minute appointment. I went to a local Lyme specialist and he did protocols. And protocols are great for a one size fits all when you're in the middle of the bell curve in the center. But when you're out on the edges, like I have over 2 dozen diagnoses, it does not work for me. I'm one of those people that reacts to everything. And he wanted me to do the protocols, and I just couldn't tolerate those. So it was difficult, and I felt lost. And I felt really frustrated with the medical community in how I was going to take care of myself and feel better. I was basically at my wit's end. My name is Sue Schoetker, and I live in Henderson, Nevada. I did have initial concerns about a group program because I found the idea of a group kind of intimidating, and that's because I had so many weird, odd diagnoses and symptoms, and I just really felt I needed the one-on-one. But that was too expensive for me, so I decided to give the group thing a try, and I'm so glad I did because the whole setup, the website, the group itself was so comprehensive, so full of resources, and the Q&As, the way Dr. Diane worked with those, I was pretty impressed with her ability to hear what you had to say as an individual, but then answer so that everybody could benefit. And she did that with each person. So the time within those Q&As was really worth it. Her clinical experience and her knowledge, the depth of her knowledge is just off the charts. And it shows up in her program itself. It shows up in the Q&As. Nothing surprises her. You don't ask her a question and she's going, I'll have to get back to you on that. It just off the top of her head. So I had a lot of confidence. That made a big difference for me. The self-guided approach I found in the website, it was so comprehensive that I could look at what was important to me. I could go through step by step or just look into one section or another section. And that was very helpful. But I also had those Q&As that made it personalized. And I always learn from other people's issues, especially Dr. Diane, the way she approaches things and being so capable of answering a question so that all can benefit. So I'd say the self-guided, it worked out for me as quite a close second to having one-on-one, but at a lot less money that I could afford. I'm not aimlessly looking for how to fix things. I'm not feeling helpless or hopeless. I have a lot of confidence that I can get through this no matter what I run into. Like in the middle of all this process of Lyme and mold, I ended up breaking my hip and I was in the hospital for 2 months and the doctors had to deal with that. And I was able to get on my laptop and talk with her through that. So the Q&As that were going to be there every couple of weeks, they provided me with a knowing that no matter how confused I felt, she was going to be able to answer the questions, that I'm in the right place, and that deep knowledge. She even helped me through the remediation while I was in the hospital. They were doing testing. I'm in the hospital and my son is at the house saying, well, how am I supposed to do this with these guys are here and they're doing this testing? And I was able to guide them because I had just talked with her like a week before and when they remediated what to look for. So there's a confidence in that. And there's an ability to see the light at the end of the tunnel without panicking. And that's a big deal, especially with mold and Lyme. I'm not sure what the group healing hub means, those words, but if you mean the website, I found it very comprehensive and also very easy to understand. Frankly, I think doctors should take her classes. I think they should get their knowledge from her website. They would really understand things better and they would have the basics to help patients more effectively. As far as community support, again, that just knowing that she was going to be there each week, knowing that I would learn something from every single one of those calls, that it was personalized, yet it was also comprehensive. It just really can't be beat with that kind of a setting. I recommend my Lyme doc because it's comprehensive, it's detailed, it's very easy to understand. There's something for everyone. She's got videos, the lessons, the handouts, articles. She has the Q&As, which are very, very helpful because they're personalized. And you learn from others too, and we all learn together, which makes a big difference. And I really do think doctors should take her class and her website because she knows more than what they're taught in medical school because of her clinical experience and her detailed knowledge. She's been around doing this for a long time, and there's a level of the depth of her knowledge that you don't find anywhere else that I've found. And she's not into the protocols. It's individualized. So I feel safe.